You're gonna listen to the machine for breathing instructions.
Estes Park resident Jän Rigby is getting ready for a quick, painless test at Estes Park Health that will yield a wealth of information about his lung health.
You're gonna go in and out of the tube twice.
A low-dose CT, or computed tomography scan, can show radiologists if there are any signs of lung cancer.
I'm getting a low-dose CT scan of my lungs as ordered by my physician so that they can have a baseline for my lungs because I'm a heavy smoker and have been for years.
According to the Centers for Medicare and Medicaid Services, Jän qualifies for a low-dose lung CT. He is between the ages of 50 and 77, shows no symptoms of lung cancer, has a tobacco smoking history of at least 20 pack years, is a current smoker or someone who has quit in the last 15 years, and has received an order for the test.
I'm trying to take better care of myself. I'm about to turn 70 this month, and I'd like to live to be 100.
Please breathe in.
Lung cancer is far more detectable and treatable than it used to be.
We now know that it's not a death sentence. Lung cancer, just like other cancers, can be cured and treated when they're found in the earliest stages, when they're the most treatable. The problem with lung cancer in the past is that there was no screening ability, and so usually the cancer wasn't discovered until the patient was very sick and very symptomatic, at which point there really wasn't much to offer.
Please breathe in and hold your breath.
The low-dose CT lung scan is fast and easy. No contrast is required, so patients don't even have to have a needle stick. It's as simple as lying on a table and following directions.
It was absolutely painless from the time I checked in until the time the procedure was completed. Could not have been more than 10 minutes. You spend more time getting dressed in the morning than this took.
There's a tremendous amount of information and, of course, a huge screening benefit to try and find lung cancer early and prevent, potentially having something get missed and have a bigger problem down the road.
I did not see any nodule or mass anywhere.
Estes Park Health radiologist Dr. Jän Knudsen is the professional who reads the scans.
We're looking for any kind of nodule or mass, spots or dots that you see within the lungs, vast majority of which are benign. We're looking for new nodules or masses, and then masses that have suspicious features like irregular borders, or especially any other secondary findings like maybe fluid in the lung or enlarged lymph nodes or anything else that might indicate that this isn't just a typical benign nodule or mass. You don't initially have any symptoms at all. You may have a fairly large and advanced cancer that you don't even know about. You may have a very small, very curable cancer that you don't know about.
What makes this particular test low dose is that it exposes the patient to about 5 times less radiation. That's important, since many people come back multiple times for the screening.
They can come back and should come back every single year until they reach the age limit.
For Jän, the test yielded good news, no signs of cancer. He is glad Estes Park Health is now offering this important screening close to home.
So like anything that's hospital related, if I can have a better experience here than having to drive down the hill, then I'm going to opt for that. Every experience that I've had here has been a positive one.
Dr. Knudsen is happy to provide this important service for local patients.
As the medical provider for the people here in Estes Park and the Estes Valley, we want to provide that kind of care here. I think it's fantastic.
If you think you may qualify for a low-dose CT lung scan, talk to your primary care doctor. For important state-of-the-art cancer screenings, think Estes Park Health. Mountaintop medicine, quality care.